What does an osteosarcoma pathology report tell you? Imagine a detailed map of your tumor, created by a pathologist who examines tissue under a microscope. That map is your osteosarcoma pathology report, and it holds key clues about your diagnosis and treatment options. First, the report confirms whether the tumor is truly osteosarcoma by looking for a hallmark feature called osteoid. Osteoid is immature bone material that appears as a dense pink substance under the microscope. The presence of actively producing malignant cells making osteoid confirms the diagnosis and rules out other bone tumors. Next, the report identifies the subtype of osteosarcoma you have. The main types are osteoblastic, chondroblastic, and fibroblastic. Osteoblastic tumors mainly produce osteoid and bone, making up about half of cases. Chondroblastic tumors contain cartilage-like areas and tend to have a better outlook. Fibroblastic types have fewer mineralized areas and are mostly made of spindle-shaped cells. Knowing the subtype helps your medical team understand how aggressive the tumor might be and plan the best treatment. The grade of the tumor is also detailed in the report. Grade tells us how similar the cancer cells are to normal bone cells. Low-grade tumors look more like normal tissue and tend to grow slowly. High-grade tumors look very abnormal and are more aggressive. The grade is a vital factor in predicting how the disease might progress and how well treatment might work. Higher grades often mean a more serious disease and a need for more intensive therapy. The report also describes how far the tumor has spread within the bone and beyond. It notes whether the tumor has invaded nearby bones or structures, which is especially important in complex areas like the pelvis or spine. It also details the relationship of the tumor to nearby blood vessels, nerves, and joints. This information is critical for planning surgery, helping surgeons decide how much tissue needs to be removed to get clear margins. Margins are another essential part of the report. The pathologist measures how close the tumor is to the edges of the tissue removed. Clear margins mean the tumor was completely excised, reducing the chance of recurrence. If the margins are close or involved, additional treatment might be needed to ensure all cancer cells are gone. If lymph nodes were examined, the report notes whether they contain cancer cells. Although osteosarcoma usually spreads through the bloodstream, lymph node involvement can influence staging and treatment decisions. The report will specify how many lymph nodes were checked and if any are affected. In cases where chemotherapy was given before surgery, the report assesses tumor necrosis, or how much of the tumor was killed. A high percentage of dead tumor cells, usually 90% or more, indicates a good response to chemotherapy. This response helps doctors predict how well the treatment is working and provides insight into the tumor's behavior. Finally, the report includes staging information based on the TNM system. It describes the size of the primary tumor, whether lymph nodes are involved, and if there are distant metastases, such as in the lungs. This staging helps determine the overall extent of the disease and guides treatment planning. The report also describes the tumor's growth pattern. An infiltrative pattern, where the tumor spreads into the bone marrow and encases existing structures, suggests a more aggressive cancer. Understanding these details helps your healthcare team develop a personalized treatment plan and predict how the disease might behave over time. In summary, your osteosarcoma pathology report is a comprehensive document that translates microscopic findings into a clear picture of your disease. It confirms the diagnosis, classifies the tumor, assesses its grade and spread, and guides your treatment options. Always remember to discuss your report with your healthcare team, who can interpret these details in the context of your overall health and individual situation. For personalized advice and the most accurate information, consult your doctor or specialist.